Standard occlusion theory for TMD. I am Sotokawa, a dentist practicing in Morioka City, Japan. This theme covers the occlusion theory essential for treating temporomandibular joint disorders, organized into the following 24 topics. This time, I will explain the fourth topic: osteoarthritis of TMJ. Standard occlusion theory for TMD. 4. Arthrosis deformans of TMJ. Contents. 1. What is degenerative temporomandibular joint disorder? 2. Definition. 3. Causes. 4. Pathology and clinical symptoms. 5. Examination. 6. Test findings, diagnosis, and differential diagnosis. 7. Basic treatment approach. 8. Intra-articular injection for degenerative temporomandibular joint disorder. 9. Perforation of the articular disc. 10. Degenerative temporomandibular joint disorder in the elderly. 1. What is degenerative temporomandibular joint disorder? Osteoarthritis of the temporomandibular joint is one of the diseases included in occlusal disorders, as shown in the chart above. Osteoarthritis of the temporomandibular joint aligns with osteoarthritis in the orthopedic field and is recognized as an official disease name. Since there are few Japanese dental literature sources explaining osteoarthritis of the temporomandibular joint, understanding this condition requires studying osteoarthritis in orthopedic textbooks, as indicated in the lower right. 2. Definition. According to medical dictionaries or orthopedic textbooks, osteoarthritis is a degenerative change occurring in the joints, involving degeneration and atrophy of the joint cartilage or bone. In other words, osteoarthritis is a condition where various stresses on the joint cause degenerative and proliferative changes throughout the joint, leading to various symptoms. Osteoarthritis of the temporomandibular joint, consistent with the definition of osteoarthritis, involves wear and tear of the bones and discs forming the TMJ, as shown in the illustration above. This leads to flattening of the anterior wall of the mandibular fossa or ossification of the ligaments, resulting in a spiny appearance. 3. Causes. According to Ockeson's TMD and occlusion, the causes of degenerative temporomandibular joint disorder can be broadly divided into two categories. The first is when malocclusion causes chronic, long-term irritation to a specific part of the temporomandibular joint, leading to degeneration and deformation of part of the joint complex. This often occurs in the elderly. The second is when the temporomandibular joint structures are damaged by trauma, subsequently left untreated for an extended period, and incomplete healing results. This type frequently occurs in younger individuals and is characterized by a history of previous jaw trauma. 4. Pathology and clinical symptoms. Pathology. A state where degenerative and proliferative changes occur throughout the temporomandibular joint, leading to various symptoms. Clinical symptoms. Symptoms are characterized by a stepwise worsening of pain and movement restriction. Crepitus may also be heard when moving the mandible. 5. Examination. Central position induction and load testing are performed. A characteristic feature of these examinations is the absence of pain. However, when the jaw is opened wide, severe pain localized to the temporomandibular joint region may occur. This pain is thought to arise because, at maximum opening, The mandibular condyle slides forward and comes into direct contact with the mandibular fossa at the perforation site of the articular disc, as shown in the illustration on the right. 6. Test findings, diagnosis, and differential diagnosis. The diagnosis is confirmed by X-ray imaging showing flattening of the articular tubercle, osteophytes due to reactive bone proliferation or ossification within normally soft tissues. It is necessary to differentiate between disorders of the lateral pterygoid muscle and disorders of the posterior disc tissue. 7. Basic treatment approach. Treatment for degenerative temporomandibular joint disorder involves addressing the underlying cause by correcting malocclusion. However, once the temporomandibular joint complex has undergone deformation, it is difficult to restore it to its original state. Therefore, in severe cases, symptomatic treatment becomes the primary approach. On the other hand, for patients wearing dentures with low vertical dimension, symptoms may improve by fitting them with dentures that provide an appropriate vertical dimension. This is thought to occur because giving the denture an appropriate vertical dimension stabilizes the mandibular condyle, reducing the opportunities for bone-to-bone contact between the condyle and the mandibular fossa. 8. Intra-articular injection for degenerative temporomandibular joint disorder. One method for symptom improvement is intra-articular steroid hormone injection therapy into the temporomandibular joint. While this therapy is highly effective for temporary symptom relief, it also carries significant drawbacks, such as worsening joint deformity and occasionally causing bacterial infection. Therefore, its use must be avoided. 9. Perforation of the articular disc. As shown in the illustration above right, progressive degenerative temporomandibular joint disease can lead to perforation of the articular disc. During observation of the temporomandibular joint region in cadavers during oral anatomy practicals at the University Dental School, this perforation is observed with considerable frequency. This condition presents as a circular perforation 1 to 2 mm in diameter, located anterior to the central constriction of the articular disc. The perforation margins exhibit a knife-edge appearance, suggesting that repeated anterior movement of the mandibular condyle caused abrasion and perforation of the articular disc. Almost all cadavers showing disc perforation were edentulous and exhibited significant alveolar ridge resorption. This perforation closely resembles the condition seen in degenerative temporomandibular joint disease, suggesting the individual likely experienced some form of temporomandibular joint symptoms during life. 10. Degenerative temporomandibular joint disorder in the elderly. On the other hand, elderly patients with severe symptoms due to degenerative temporomandibular joint disease are not particularly common. However, it is possible that cases with mild symptoms are being overlooked. Furthermore, since symptoms of degenerative temporomandibular joint disease worsen in a stepwise manner, severe symptoms like spontaneous pain may not occur in the early stages of perforation. Instead, they are more likely to develop in the late stages when the perforation has significantly enlarged, the periosteum is worn away, and bone-on-bone contact occurs. Dentists may be overlooking a significant number of patients with degenerative temporomandibular joint disease and leaving them untreated. It is hoped that advances in the diagnosis and treatment of this condition will lead to more appropriate dental care in the future. Standard occlusion theory for TMD. 4. Arthrosis deformans of TMJ is now complete. If you enjoyed this topic, please click the like button. If you have any questions or concerns, please write them in the public comments section below. The next topic is the 5. Disease of lateral pterygoid muscle,